Hi guys, Chris Lendrum here from strengthphysio.com, and in today's video we're going to go through a quick conditions video of Meralgia Parasthetica. So general causes and pathophysiology of this condition is essentially a lateral femoral cutaneous nerve pathology, possibly due to a compression as it passes the inguinal ligament. It's generally an L2 to 3 nerve type distribution. It can be quite an uncommon pathology, except in pregnancy, and for those reasons will become clear in a second. Can be caused by a trauma near to the groin, around that ASIS region, around that inguinal ligament region, and also by pelvic masses, pregnancy, basically anything that can cause that increased pressure in that area to the nerve. Tight clothing as well can be a factor, so asking the patient about those sorts of things can be useful. And if someone's had some hernia repair, inguinal hernia, or some gynae surgery around that area, it's worthwhile noting that down, because again that could be something that is causing the nerve to be irritated. Obviously repetitive cycling and flexion extension of the leg, or being in that compressed position for a while, could also be a factor in causing some inflammation around that nerve. Also can be a post-surgical complication from hip arthroplasty. So again, similar sorts of reasoning and concepts to the other issues. So subjectively, patient's going to report a sensory disturbance in the trouser pocket area. So it's the anterolateral thigh that they feel their symptoms on, and will have pain in that anterolateral thigh area as well. Generally don't have back pain with this sort of condition, but again it could well be a condition that is combined with other things as well, so don't rule it out just because someone hasn't or does have back pain, but it's generally not seen alongside that. Again, as we mentioned before, it can be caused by a trauma near and around the groin, around the ASIS region, but it could just be from repetitive type activities that cause aggravation to the nerve. So objectively, I've got increased pain and paresthesia on palpation of the nerve near the ASIS, reduced light touch to sensation on the lateral thigh, increased response to pinprick on the lateral thigh, no motor loss generally, and a positive Tinel's tap below the ASIS. So again, if you're getting those symptoms or the signs and symptoms doing these objective tests, it's something that to definitely think about. The differential diagnosis in this sort of condition, we've got disc pathology obviously coming from the lower back, we've got femoral nerve type pathology or femoral nerve tension type pathologies, and potentially some sort of vascular problems. So you want to ask about general health and make sure that there's none of those issues going on with the patient as well. Management wise, a lot of physio is going to be on advice to modify activity. Basically you want to try and reduce that compression and irritation of that nerve. So exercise therapy, neural gliders, those sorts of things, combined with manual therapy to restore some mobility of the hip and surrounding structures, can be really useful. So lower back, hip, just looking at general biomechanics, how that person moves, and then educating the patient on clothing, etc., that could be causative factors, or any of those issues you've found in the subjective where you think that could be having an impact. Obviously you want to modify that to reduce the impact as much as is possible. If none of that works, then you could also, this is alongside actually, so alongside that you can also do taping to offload the nerve through a dermoneuromodulation effect. But if none of that works, or if conservative management fails, then onward referral to a neurosurgeon may be needed to see if they can do anything surgically for that. So that's a quick conditions on Meralgia Parasthetica. Hopefully you enjoyed that, guys. Please like and subscribe the video if you did, and I look forward to seeing you on the next video. Cheers.